So this evening, I am hoping you can all see my screen. We do have a Q&A function down the bottom, so it just has Q&A and encourage you to pop in any of your questions there. This evening, we really wanted to talk about the healthcare system and get an understanding from it and from a perspective of all of us who are healthcare users and trying to understand how we actually use the system. And if it's news to you, I'm sure there'll be other people who are also not sure. I remember experiencing it myself, um, for the first time, and it can be quite intricate and really different and really difficult. So we will get started. Okay. So I just first like to acknowledge the traditional custodians and country throughout Australia and their connection to land, sea and community. We pay respect to past, present and future people who have walked and cared for the land, and we would like to acknowledge and respect their continuing culture and the contributions made to the life of the country. I'd also like to acknowledge anyone with a lived experience or their significant others who also walk along this journey with them, and acknowledge the many leaders, tribes, people, and organisations and advocates who have spoken about the issue, the topics that we face today. And they have spoken about this for decades. We really do stand on their shoulders, and we are doing this work which builds on their legacy and their dedication to their advocacy, which has preceded us. Now, who is Quendo? So we are a non-profit organisation, and our role is to support people affected by endometriosis, pelvic pain, adenomyosis, PCOS, infertility, pelvic pain, all of the things. We were established in 1988, and I took over the organisation a number of years ago. And we really sit in the space of delivering services, delivering free services to people who need some support. This includes a helpline, our mentor program, our nurse navigation program, webinars, education, our app, which we'll talk about soon as well. In partnership with the Brisbane South PHN, we were awarded a grant to provide some health literacy information, and we also deliver local communities, education to local communities. So our goal is to really ensure that people, especially those priority populations and those in rural and regional areas who are underrepresented, have access to care information and support they need to navigate chronic and complex health conditions. Now, we have spoken with many different communities across the years, and we know of the real significant issues. One of our team, Ash, just visited Weipa, which, if you don't know, is really, really quite high up the top of Queensland. And just learning about those significant challenges that people face locally and working out how do we improve that. Coming back locally into more of the metro regions, how do we also support people who are unable to access care? And regardless of your postcard, we believe that people should be able to access care. So, like I said, we have been granted a grant in collaboration with Brisbane South PHN, which is the Brisbane South Primary Healthcare Network. And their role is to partnership with health professionals and communities to improve the health and outcome of everyone in the region. So what are we going to cover here this evening? So this is part 1 of 3. Tonight we will cover your healthcare rights, how the hospital and healthcare system works, understanding the Australian healthcare system in its complexities, choosing the right service, and next steps. So, like I said, if you do have questions this evening, please pop them in the Q&A. And while I have you here, I'd like to ask that you do a little bit of a test. So can you tell me, I'll just go forward. Oh, no, it's not there. In the Q&A, if you are here as someone with a lived experience, can you please pop a blue heart in the Q&A? If you are here as a support person, can you also drop a pink heart in the Q&A? And if you are both, you can pop in both. And I'd really like to know in that Q&A if you can also tell me what are you hoping to learn about the healthcare systems. And we'll just also utilise that a little later on. I can see you all popping in there, so that's great. Keep them coming. Like I said earlier, we have 2 other workshops. So they're next week, one on Tuesday from 12 to 1 p.m. And this is I'm really excited for this workshop. It's one of my favourite ones. We want to give you tools on how to advocate for yourself in the healthcare system and how to communicate effectively. So this evening will be a lot about what is the healthcare system, what are the different areas that you can contribute to. And yes, we want you to learn tools on how to advocate for yourself in the healthcare system. It's really tricky. It can be really tricky, but we want to give you some of those tools that are totally implementable. You can take them home with you and use. And then on Thursday evening next week, we're going to then work out, okay, what does a personalised navigation plan look like for you? We have lots of tools and templates that you'll be able to follow along with. So I'm excited about those 2 because there's lots of things that you can take away. And this evening is very much focused on, understanding the actual healthcare system itself. Next week, oh, I'm so excited. I want to give you all of the things that we have learned over the years so that you can use them. And like someone has said, we have so much trouble being listened to in the healthcare system. And yes, we know our bodies, but we need to communicate that in a way that health professionals will listen and understand. They are doing a job themselves. So yes, it's one of my favourite programs that we're going to run next week. Okay. So your healthcare rights. I want you to understand that in Australia, we have something called the Australian Commission on Safety and Quality in Healthcare. This is a national standard. They're called the NSQHS standards, the Australian Commission of Safety and Quality of Healthcare. And so this is there's many different standards, and under standard 2, there's one called partnering with consumers, and there are levels of partnership. So in the healthcare system, we talk about consumers, which are really patients. So whenever you see the term consumers, they're talking about patients. So they're consumers of that healthcare system, which we all are. Now, you have under this standard a right to access healthcare, and you actually have a right as a consumer and or patient to partner with health services to improve them, to ensure they're safe, to ensure there's quality at both the individual level, the service or program level, as well as the organisational level. So this here is the individual level. So you, as an individual patient accessing healthcare, you have a right to provide feedback. You have a right to access quality and safe care. At a service or program level, this is where consumers come in to review a service. They might review a particular policy. They might review how an actual organisation within the health system is set up, or review how it should be changed going forward. And then at an organisational level, this is more of a strategic place where consumers or patients can sit. So yes, you are all consuming healthcare. We are all accessing healthcare in various ways, but you also have a right under this Australian Commission on Safety and Quality Healthcare standards to have more of a say, and that's really involving yourself as a consumer in that decision-making part of the healthcare system. And I think that's a really important part to remember as we're going through all of this. Okay, again, if you have questions, you're very welcome to pop them in the Q&A. So as I said, your healthcare rights, you have the rights to safe, respectful and culturally appropriate healthcare. Now, I've taken this from the Australian Commission on Safety and Quality in Healthcare website. This is public information. So this is essentially your charter of or rights, charter rights, yeah, that you can ask questions, seek second opinions, access interpreters, and the health services must protect your privacy and involve you in the decisions. I am sure we've all had an experience where we have felt like we are not involved in decisions. And workshop 1 and set 2 and 3 will really talk through how do we ensure that we are effectively communicating so that we are. But at the very, very basics, you have a right to all of these things. So what does it look like? So you have a right to access. You have a right to access services and treatments that meet your needs. And if you don't have the access to that, there is something in some states and territories called the patient travel subsidy. So if you're not able to access a service locally to you, then you will be able to apply to something called the patient travel subsidy, PTS, and there will be an officer within most public hospitals that will help you. And you are able to receive remuneration if you meet the criteria at a certain number of cents per kilometre. So if you are needing to travel, so say you're up in far North Queensland, needing to travel to a metro area, or out in Orange, needing to travel to a metro area, there is a patient travel subsidy that can often help you. And, you know, even if you're at Laidley Hospital, which is just in West Moreton of Queensland, needing to travel to the PA hospital, the Princess Alexandra Hospital for something like cancer services or access to treatments, you again can apply there. So the patient travel subsidy, if you don't have, again, this access and you have the right to access to treatment and care that meets your needs, this is an area that you can certainly ask for if you do need to travel. For those who are asking about these leaflets, absolutely, we will have them made available to you after the webinar today. The second right is safety. So this is around receiving safe and high quality healthcare that meets the national standards, and noting as well that this will change in terms of the standards for each of the different locations. So with that, we have a right to be safe in our healthcare systems. This also comes down to the right trained and appropriately trained health professionals. And in this space within endometriosis, I know that can be really difficult to find. So you have a right to ask, are you trained in this particular surgery? What level of qualification do you have? If it's for a sonographer who's doing an ultrasound or pelvic health ultrasound, asking them, do you have additional training? What training have you undergone to perform this particular procedure? How many of these do you see? How many operations do you do on endometriosis? For example, what are your outcomes for the patients? Yeah, for the patients that you do operate on, how are they 12 months after? You do have the right to ask these questions. Then there's respect, which is, again, I think we can definitely feel disrespect in a lot of ways when we do access the healthcare system. But you do have the right to respect, to be treated as individuals with dignity and respect, and also have culture, identity, and beliefs and choices recognised and respected. And for those people who do identify as other genders, and they may show up in the healthcare system with an assumption, or other health professionals with an assumption that that person is female, without really thinking about their identity or asking those questions to ensure that people are feeling respected and they are creating that psychologically safe space. This is often one that can be forgotten, but like I said, in webinars 2 and 3, we'll talk about how can you be proactive, because whilst we have these rights and we have these rights to access care, we're also entering into a partnership with health professionals and a partnership with the healthcare system, and we can do a lot to really assist in that partnership. The next one is partnership. So your ability to access questions and ask questions, and I might just see if I can zoom in for you. There we go. Partnership, ask questions and be involved in open and honest communication. and the ability to make decisions about healthcare providers to the extent that you are able to choose and are able to. And also including the people that you want in planning and decision making. So that might be um, your family members, your support system. A lot of the time it's us here at Quendo, we get involved. If someone's really struggling to communicate what they need, we help them and support them through that, or help coach them through that. But having that partnership, you have the right to ask the questions and be involved in that decision making. And again, in webinars 2 and 3, we'll talk about what happens and how do you do that. Then there's information. So you have the right to information about your condition and the possible benefits and risks on the different treatment options, so I can give my informed consent. I'm sure we've all experienced a time where we've been flooded with all of these ideas and you can try this treatment or this treatment or this treatment, and you just don't know what to do. And it's very difficult to feel as though you are informed to make those decisions. And so this is where having the right information and being able to ask the right questions will be key. And again, we have a tool for that, which I'm excited to share with you. You have the right to receive information about services, waiting time, and costs. We know in the healthcare system at the moment, the waiting times are significant. And I would really like to know in the chat, has anyone, if they are on a wait list for a public hospital, do you receive a period or an understanding of how long your wait times are? We have category 1, category 2, and category 3 in the health service. Category 1 is, I believe it's up to 30 days or 90 days. Category 2, a little longer. And category 3 is really categorized within 12 months. And I don't believe we're seeing a lot of people sitting within that time. And we're seeing people sitting on wait lists for a lot longer than that. But you do have the right to ask, and you do have the right to be informed. This will help you immensely in advocating for yourself back with the GP, or chatting further with what are your next options, what are your next steps. You have the right to be given assistance when you need it, or to help understand and use the health information. So if you're having troubles or difficulties understanding the different topics or what's being proposed to you, you have the right to that information. You have the right to request your health information. And I would really encourage you, before you leave emergency, before you leave or be discharged from a health service, ask for a printed copy of your documents. Now, if you do not receive those, and you do need to access them at a later time, there does become a cost. There's a processing or admin cost associated with that. So when you do enter the healthcare system, always ask for a printed copy before you leave and keep that with you. You can scan and upload it to the Quendo app, keep it in a document ready so that you have your information at hand if you do need it in the future. You have the right to be told if something has gone wrong in your healthcare, how it happened and how it may affect you, and what is being done to make care safe. Now, within our healthcare services, there's a role called the CLO, which is the Consumer Liaison Officer. It used to be called the Client Liaison Officer. Now, that role in the organisations, they will receive all of the positive feedback, but then they'll also receive the feedback when things don't go quite right. And you will have an access and right to contact them to share about what's going on or what happened to you in the healthcare system. This is predominantly at public hospitals, but also private hospitals will have a similar role. And if you feel as though that your healthcare didn't go quite right, you can write to that individual, you can write to the health service to ask for a review, to ask, can you help me understand what happened here? And then that can often look into a greater review around, is this a theme that's happening? Is it a pattern within that health service? So your letters and your written requests for an understanding can really help to trigger a bit of a review in a particular area. So don't underestimate it, and it is your right to do so. You do have the right to privacy and have that be respected, and also information about you kept safe and secure and confidential. Now, in the public health system, this is, and all health systems, we are very much governed by strict laws around this. The HIPPA law, Health Information Privacy Policy, I believe in Australia, is a really good one that you could look up. It's got lots of information about how you store your personal information, how to define that, and we all have that right to that privacy. It's one that the Qendo app is built on, and we have always had that as front of mind with whatever we do. Now, you also have the right to give feedback, and this could be providing feedback or making a complaint, and it really should never affect how you're being treated. You might have your concerns and they need to be expressed in a way that's transparent and timely. So that also should never be impacting your care or your treatment. And you have the right to give your experience and participate in improving the quality of care and health services, which are those 2 or 3 levels that I spoke about just before, which is here. So you have a right to be involved in these. Now, this is all goes without saying that this is all of this is confidential, and you have the right to share and provide your feedback without it impacting your care, like I have just said. I believe we would have some concerns about that. I'm sure we've all experienced some concerns about, care if we speak up, but doing it in a way that is in partnership, that is kind, from a place of trying to understand what happened and what went wrong, and what really the solution is that you'd like to see, can really turn that around. I personally have actually worked in the role as the client liaison or consumer liaison officer within the Queensland Public Health Service. So I understand that role a lot, and the power of it, and also how to, get things working. So we'll talk about that in webinar 2 and 3. Now, how do you use this charter? So this is a great resource here. Again, we'll send them around to you. So essentially, you know that you have rights. You know that you can ask questions. You can tell your health provider what is important to you. You get the information, and that you understand that information, and that you can include family and health, other health professionals, carers and friends, and you make decisions together. The whole idea of these standards is to improve the quality of care, and health professionals really are trying to do their best job. They are stretched enormously a lot of the time, and they're often just trying to do the best that they can with what they have, as are we as patients. So knowing that you do have these healthcare rights, I hope this gives you some confidence to know I do have access, or I do have a right to access to care that is appropriate, that's respectful, that's in partnership, that I will be protected, that I can give feedback. This is how we improve healthcare services, by feedback. Yeah, so important. Okay. So how does the local healthcare system work? We have a range of different healthcare systems in Australia. So I'll just say that we have many different healthcare systems, and I'll just talk about some of the main ones. So we have community and allied health services, and you'll notice that I put that first. I put that before the GP, because we often are talking with our physio, psychology, a dietitian, and other forms of pain management. It may be an acupuncturist, it may be a chiro. There's so many different community healthcare services out there. They're often referral based, or you can go in and book an appointment yourself. And they're often co-located within GPs or community healthcare centres. So they play a key role in the management of chronic conditions. They are the people that we build this team around. You'll hear me talk about building the team, yeah? And often we'll go see the physio or the chiropractor before we even get to our GP, and we're looking to follow it up there. Particularly for endopelvic pain, we're really utilising those community services first and foremost, and the allied health services. You also have Qendo, where we have our wonderful nurse Jill, who can speak with you in learning how to navigate all of this, to debrief with you around what's going on for you and the next steps. So that's a free service. You don't need a referral to that, and you can just go to qendo.org.au/Qendo Care, and you can book straight in to see and speak with her. The next one is your general practitioner. I'm sure we've all seen a GP in the past. This is your point of contact, and GPs have done a lot of work recently. A lot of them, not all of them, uh, a lot of them have done work recently to really try and improve their understanding of the condition and also understanding of how do they help you. For a long time, they were pigeonholed as the gatekeepers to the next steps. But we've come so far in giving them some tools and some confidence, I think, to help get people from that GP's office to all of the other people that they need to see, all the people that we need to see. So they can refer to specialists, they can order blood tests. A lot of them are bulk billed, a lot of them are not. And a lot of the time, it's partially covered under Medicare. Then you have your specialist. So this is your specialist space. It can be the next point of contact for your healthcare concerns. And the specialist is there to really understand what's going on for you. They are looking in the area of, particularly for endometriosis, they're trying to understand, and they have that specialist knowledge around hormone therapy, around treatment options, whether or not surgery is the next best thing for you. And that's really to understand that whole clinical picture. Now, your GP can do a lot. So they can do things like order an ultrasound. So going and asking for an ultrasound for an ultrasonographer, an ultrasound place that does provide pelvic health ultrasounds. So what that is, it's not a 20-minute appointment, it's about an hour. And that pelvic health ultrasound is really having a good look at your pelvis. In some really well-trained sonographers, they can detect endometriosis, deep infiltrating endometriosis, as well as superficial, so a couple of dots on the surface, depending on their level of skill. But what we're trying to do at this phase is we're trying to map out what's going on for you. We're trying to rule out, is there anything really scary? Is there any cancer scares or concerns there? So we get some bloods done. We're trying to understand what your hormones are doing. So we might get some bloods in that space, or to look if there's any deficiencies. Then, so that's the bloods. Then going and looking at the ultrasound. Okay, having an ultrasound, looking to see if the bladder is working, if the bowel's working, or if they're stuck together, having a look if the ovaries can move. I often describe ovaries as those the wacky inflatable mans. You know those guys at the car parks where they're just all moving around nice and fluidy. That's what our ovaries and our places in our pelvis want to do. They want to be fluid. They want to move. And with the adhesions, they stick together. It's horrible, and they're really unhappy. Yeah. So an ultrasound, a pelvic health ultrasound, who knows what they're doing. I'm not just talking about Joe Blow down the road. A really, really good well-trained ultrasonographer and sonographer with the most recent technology can have a good map of your pelvis. Can look at, okay, what's impacted? Can the ovaries move around? With the probe, it's an internal ultrasound. We have a whole video on that in Manage Endo. Can they move the uterus around? Can they move and mobilize the bladder or the bowel? They're trying to get a bit of a picture around what's going inside your pelvis. Now, that's why we want an ultrasound, yeah, from the GP. That's probably why hopefully why they are referring you. And you want to take all of that information to the specialist. And the specialist goes, okay, we've ruled out all of the really, big C cancer ones. Okay, I'm confident that that's not the case. What's going on with your hormones? Do we have low progesterone? Do we have high testosterone? What's happening there? Looking at the scan with a really, really good report. What's happening here? Okay, I can see that perhaps the bowel's not moving well, or this is not really doing what it's supposed to. And they're really looking to understand your whole picture as a person. They want to know from you and from all of these different tests, where do they start? Yeah, because endo is invisible. We can't see it. It's not like a broken arm. Pelvic pain is a diagnosis in itself, and it's often the biggest symptom, that pain that we're experiencing. So for a specialist, they're trying to work out, where do I attack first? And all of these bits of information really help them. So that's your specialist. Now they might bring in, I'm talking about a gynecologist here, they might bring in a gastroenterologist if they notice there might be a concern with your bowel. They might bring in a urologist if they're concerned about your bladder or your kidneys, or your, that entire system there. They might bring in a thoracic surgeon if they're concerned about endo, on your lungs or in your diaphragm. They're trying to work out as well, who else do they need in their team? Because they have a toolbox and they have a team as well. And each different specialist will have different teams and different toolboxes, just like you do, just like I do, and like every health professional. Now, we really want to ensure that if we're going to this stage, we want to access some sort of pelvic health physiotherapist or education around it. Because whilst we have the lesions in the body, that is endometriosis, we also have the symptoms. And we know that the amount of lesions in the body don't equate or don't equal the amount of symptoms that we're living with. So someone that has stage 1 endometriosis, so a couple of different lesions around their perhaps pelvic area, they might be in the most enormous amounts of pain, be significantly impacted by the disease, but they only have stage 1, a couple of little dots. Whereas someone who has stage 4, deep infiltrating endometriosis, where their bowel is stuck to their ovaries and their pelvis is just completely congested, they might not experience any symptoms at all. And they only know that they have endometriosis because perhaps they tried to have a baby. They went down IVF path and had an incidental laparoscopic finding of endometriosis, but they never had a symptom. So the amount of lesions in the body, we know, do not equal the amount of symptoms that people are living with. And just under half of people that do have surgery do find some sort of symptomatic relief. So there is absolutely that role of surgery. And for some people, it's incredible and it's life-changing. We need to keep that as a tool. We also need to look at all the other tools. Moving on to hospital, clinic, and emergency. So this is where you have serious life-threatening conditions, and you often will expect long wait times unless it's very urgent. We've all had an experience with emergency, I'm sure. So I'll break that up there in two areas. The hospital clinic is your outpatients department. So this is where the GP might refer you to a public clinic, and that would be categorized by a doctor within that department. So you have a referral sent to the gynecology department, and there's often a doctor who is triaging all the referrals, and they're working out based on that symptoms from that doctor's letter, which level of categorization do I put you in? That's why that GP letter can be so useful. If you can work with your GP to get those bloods done, to get a really good high quality ultrasound, you can say in that GP letter, we've ruled out the cancers, we've ruled out the endometrial cancers, the big scary ones. We've tried physio, we've tried to change the diet, we're working on all these things, and yet we're still in pain, or we're still having symptoms, or this is still happening. And having that written in your letter will really, really help that person who is triaging that referral in the hospital. They don't know who you are, you're another letter. So communicating your story in that letter will be so key, and you can work with your GP to do that. Now, within that letter, attaching the ultrasound, you can see in that letter, the report from the ultrasound has found the bowel and the bladder aren't very happy. They're stuck together, and attaching that will really, again, help provide that clinical picture of what's going on for you, back to that individual in the hospital who's just reading from this letter. Now, when symptoms worsen, going back to that same GP, or if things aren't just getting better, this is where you can have your GP advocate for you, writing to the outpatients department again, saying, for example, or public or private, and saying the symptoms are worsening. I'm getting the pain is increasing. We are trying all of these things, right? So as a patient and as a GP, we are showing up from our side of things in that partnership, what we engage in with the healthcare system. We are showing up, we are doing our part to try these different things. We have the Manage Endo program, which is on our website. It is free. And people are utilizing that when they can't afford a physio, a psychologist, a counselor, a dietitian, all of the things. We've gone out to incredible health professionals and asked, can you help us record 3 or 4 different tools or strategies that someone could implement into their week? And we've recorded that, and that is up on the Managendo program. So you can start to learn and try all of these things. So hopefully by the time you get to that outpatient's appointment in the hospital, you're able to say, well, I tried this and it worsened my pain, or I tried this and it improved this symptom, and go forth. What's in your toolbox? You're starting to build your toolbox, and you're going to that health professional with education, which is health literacy, hopefully some confidence because you have really tried and become educated in the space, and you're informing them, this worked, this didn't work, this worked, this didn't work. And hopefully that will help progress your next steps, rather than, which is what's happened historically, is people have sat on a wait list for so long. I have done this myself. No education, no support during that time. You finally get to an outpatient's appointment, probably waited a really long time to get there too. And you have a short period of time when you're trying to communicate your whole life story in a really short period, and also then work out the next steps. Yeah, it's really difficult. But if you can go in with proactive conversations, this, and this, which is what we'll get into in workshop 2 and 3, then this will seriously help you to get to that next step where you want to go. This is advocating for yourself in the healthcare system. Emergency. The emergency department is a mixed bag. And what we have is a chronic condition that is pelvic pain. It's a chronic condition, and emergency departments are set up as an acute facility for acute. So that means urgent. Yeah. Chronic condition in an acute environment, they don't work. They don't mix well. But more recently, in a lot of different emergency services, is a new pelvic pain guide. So there's an actual guideline that a lot of health professionals can follow. Now, you could say to someone in emergency, we'll go through it in the next webinar, here's about me. If you're not sure what to do, look up within your internal intranet the pelvic pain guideline, or what to do with a patient, and they have built them. We have been a part of building them in different health services so that people who have no idea about the condition in this space can at least start to follow some guideline. Then we have urgent care or care clinics. So this is for walk-in care where it's not life-threatening, like minor infections, sprains, and they have extended hours. There's no appointment required. So hopefully with the introduction of these care clinics, people will be able to understand or alleviate some of the emergency departments. Now, in some hospitals, we will talk about this in the next webinar, but there is dashboards that you can look up to find what emergency department wait times are where. So you could Google now if you wish to look it up. Queensland, in Queensland, it's Queensland Health emergency wait times, and there's different dashboards. So that can help as well to determine what you're going to do. There's also 13 Health, which can be really useful, but also you can call us. We have our wonderful nurse Jill. We have a helpline, and we can help navigate the next steps for you if you're needing some support. Okay, so people absolutely are welcome to pop in their questions in the chat too. We would really encourage you to do that. I can see them coming through, which is great. Okay, so how do these actually work? Okay, we have Medicare. So this is Australia's public health system. So this is where if there's bulk billing, we have subsidised GP visits. Some of our specialists, we can get a rebate. We have hospital care, tests, and some medications. Now we provide an annual survey. It's called Raise Your Voice Survey. It's available on our website now. It's always available, where you can tell us what you are needing right now. And this is what helps us as an organisation lobby for different things. So it may be that you are telling us you need a particular medication on the PBS, the Pharmaceutical Benefit Scheme. We'll get to that in a moment. And so how we decide as an organisation and how we decide in terms of what we are advocating for We are looking at that, going, okay, what are the themes? What are people telling us that they need? A lot of people are telling us they need, and we prioritize them accordingly. So this is how advocacy can help get more things available through Medicare item numbers. So 1st of November, we'll see a Medicare item number for the pelvic health ultrasounds. There's a specialist Medicare item number coming in, whereas a long GP visit Medicare item number. So we're trying to bring in more of those accessible services. So we have, like we've said, GP general practitioners. So again, a lot of the time, first point of contact for those health concerns and referrals. You usually do need to see a GP to see specialists or access certain services. And they do have a lot of telehealth services. So COVID, one good thing that came out of COVID was the introduction of telehealth Medicare item numbers. And so people who are working remotely or living remotely rather and needing that virtual care can access some people. I know in Brisbane South, there is a GP clinic that actually sees people from Cairns. They're a fabulous GP clinic. Amazing people work there, and they service a lot of people from Cairns all through telehealth. Then we have public hospitals which are free, again, like I've been talking about in the public health service with Medicare, and private, but it does offer more choice, and there is shorter wait times, but there is a bit of a cost, which is where your private health does come in. Now, when you are going for surgery or having some sort of procedure, you can, if the private surgeon does enable this, you can access something called intermediate care, which is essentially where you are a private patient but in a public hospital. So in public, you're not paying for things like your beds, your care. There's no out-of-pocket costs other than perhaps a bit of medication if you do need that on discharge. However, in private, you're paying for your bed, which is covered often by your gap fee, your private healthcare. You're paying out of pocket or even the gap for your surgeon and your anaesthetist and anyone else they need to bring in. You're often paying for, in the private space, bloods and medication, depending on your level of cover. But if your private surgeon does have what we call credentials or scope of practice approved in a public hospital, and they do allow that, you could potentially ask to be seen as an intermediate patient. That's where you are a private patient. So you have your private surgeon, and often their anaesthetist or their gastroenterologist or whoever else they're bringing in, and you are being seen in a public hospital, so you're not paying for the cost of your bed. Some do that, some don't do it as much these days, but it's certainly a good question to ask. Then you have the pharmaceutical benefit scheme, which is what I mentioned earlier. This is reducing the cost of medications that are prescription. So the prescription medications can be enormously expensive. We've just seen, for example, Slinda, which can be several hundreds dollars, come down to $31. Now, what we find on the PBS is there might be some medication shortages, and that can happen. And so if that does happen, it would be good to talk with your GP about next steps, about what that looks like. Because often why we want things on the PBS is because we want to give people choice. We want to give people the ability to decide different or try different medications. And they can do that because they're at a lower cost. If they're not on the PBS, we all know they cost several $100s to try them, which for some people, it's just absolutely not feasible. We can't even reach that, access that. So we want more choices on the PBS, but often it can come with some shortage issues. So you have a bit of a plan in place and think about what does that look like for you. Sometimes changes to the PBS also change the prescription timeframes. So have a think about if you are seeing something coming up, or if you do see an announcement, again, make a note to talk to your GP about prescriptions and what does that look like and does it change for you. Also talk with, there might be a practice nurse if you can't get in to see your GP, or your pharmacist, which are an awesome connection in the community. They have so much knowledge and they often have a lot of time. So, well, some of them are really busy, but they do have time to provide education. Then we have healthcare cards and bulk billing. So this is for low income earners. There is no out-of-pocket cost for people when they're bulk billed within the GP space. Some physios will, but again, it's becoming less and less. GPs are really under the punch. Some people ask where they can get free pelvic health physio. Now, within the public health service, you have your specialist clinics like your gynecology or urology or all of those different areas. But you also have things like allied health. So you have physios, and there are a growing number of pelvic health physios in the public health service, which is so exciting. You have dietitians, you have psychologists. So there is a multidisciplinary team in public health services and a lot of private as well. So if we're talking about where to get free, you can ask your GP to refer you to the allied health department. So you want a referral to the pelvic health physio in the allied health department of X hospital. Now, for example, the QEG hospital, there is an amazing group of pelvic health physios that work there. So getting a referral into them. It's a really good question. Hopefully more free services will become available very soon through lots of different areas. But yes, so stay tuned for that one. So how do you choose the right service? What's it for? Do you need a referral? So to go to your GP for those everyday health issues, for your chronic condition management, GPs can work with you to develop a chronic disease management plan. Now, under the chronic disease management plan, you are entitled at the moment to 5 subsidised allied health sessions. This is physio, psychology, dietitian, and a couple of others that are on the list. Now, this is where you can go and see a pelvic health physio, often for free if they don't have any out-of-pocket costs, if you are approved on a chronic disease management plan. With endometriosis and pelvic pain, you are absolutely eligible for that. And your GP they'll spend quite a lot of time with you to talk through what does it look like. And you're essentially developing a plan to manage your chronic condition. Endo is chronic, so is pelvic pain, as is adenomyosis. This is lifelong. And so definitely think about, and when you're booking, even on the online booking systems to see your GP, there'll be often a drop-down option to book in to talk about a chronic disease management plan. So it's a really good one. It's a longer appointment. GPs, they are remunerated to actually do them. And so it's one that can be really useful, but there is only 5 appointments. We are working so hard to increase that number of appointments, but definitely is another way that you can have a free or a subsidised allied health support. For the urgent care clinics, you have minor injuries, infections, non-life-threatening urgent issues. So you don't need a referral there. Your pharmacist, like I said earlier, for medication advice, minor illness treatment and health info, you don't need a referral. They're such a great source of information and also the most up-to-date information about different medications. ED departments, you don't need a referral. Life-threatening is significant. Often with endo, we just cannot cope sometimes with the level of pain that we're in, or we might be experiencing another symptom, or we might be feeling as though an ovary is rupturing, or we are just not okay. So whilst the accepted terms is life-threatening emergencies, we also know that there are situations where we can't help ourselves at home. We've tried all the things in our toolbox. We might have called 13Health and talked through what's going on for us, and they might have referred you with an emergency, with an ambulance or to the emergency department. But you don't need a referral to go there. For your surgery, so gynecologist, we often will always need a gynecologist at some stage with endo or pelvic pain. So finding one that works for you, someone that is hopefully trained in the space, so you can ask if they are AGES, AGES, the Australian Gynae Endoscopy Society trained. So that means that they have gone on and done additional training in the space of minimally invasive laparoscopic surgeries. That's our LAPS that people with endo will receive. We want to make sure that they're trained well. And so you can ask them, or often on their website, they'll talk about that. Now, I want to just quickly touch on the term endometriosis specialist. There is no such thing as an endometriosis specialist. Within the college, the RANZCOG, the Royal Australian College of Obstetrics and Gynecologists, they have over 120 different subspecialties. So they have obstetrics and gynecology, and then all these different subspecialties of of sorry, everything's going off, of different subspecialties. So it might be urogynecology and so forth. So there's a lot of them already there within the college. Now, for a long time, the conversation has been, do we need a subspecialty for endometriosis? That is an ongoing conversation. We're not quite there yet. But I will say that you cannot have a specialist gynecologist in endometriosis. There is no such thing as that. There is no category for that within the college where they are granted their licensing to do this work, and so it's become a buzzword. So that's really difficult to work out who to go and see. To completely understand that. But I do want to just make sure that we're understanding that there is no endo specialist, because they literally can't be a specialist in endometriosis because the college does not have a subspecialty for endometriosis. If you have questions about that, please ask them in the Q&A. I hope I've made that clear. What you can do though is you can ask them, are you AGIS trained? What's your quality of life outcomes for the people that you do operate on? What number of patients do you see with endometriosis in a year? You can ask them questions. And when you are talking with your health professional, you are employing them. Regardless if you are giving them your money, paying for the appointments, or through bulk billing, you are paying them, you are employing them in your time, in your energy, in your space. You are exchanging something with them, and you have the right to the right people in your team. So when you are trying to understand, are they the right person to work with you, asking these questions is absolutely within your rights. Okay, again, if you have questions about that, please pop them in the Q&A. Mental health services, so you have counselling, therapy, and crisis support. Now, it depends whether or not you need a referral for that. So for some different areas, you will need a referral. So a psychologist, you'll very likely need a referral in some cases. You can also talk to your GP about a GP mental health care plan. This is where you have access to subsidised services or appointments with your psychologist. Just a warning, there is still often an out-of-pocket fee, so just check in with that or call around to different psychologists to see, one, if they gel with you, if they align with you, but also what their out-of-pocket costs are. A lot of counselling services don't need it. There's so many wonderful counsellors in this space, particularly in the space of endo and pelvic pain. Often they have endo or pelvic pain themselves. They're a really, really good service, and often they are trying to teach you tools on how to manage things day to day. We're never ever saying that endometriosis or pelvic pain symptoms are in our head. They are real. They are real conditions. They are real things going on in our body, but it is often a lot to manage. It is overwhelming to manage these complex conditions. Talking with somebody and getting some tools around that is enormously helpful. Telehealth, so routine follow-ups, regional support, or low mobility access. Some will need a referral, some won't. Our telehealth service, you don't need a referral. You can just book straight in. Others will. And then you have your community and allied health, so your physio, your dietitian, your occupational therapist. They are such an amazing space in this chronic disease area. They're really well utilised in the disability space, but they can absolutely help to integrate everything that we are needing to manage and then actually live with these conditions. So an OT can be a really great resource for people to access, and I don't think we often think of them as being a part of our team. And again, those support services. Okay, how are we going? Lots of talking. So what is continuity of care? We are all aiming for continuity of care. This is a chronic condition, it's lifelong. We need to learn to and work out how to build the toolbox to manage conditions, but that also involves relationships with your GP or care team. So continuity of care is about having someone who really knows you and not having to start scratch from every appointment. I'm sure we have experienced that. It is where they get to know you, your history, your values, your preferences. I'm so excited to talk you through in the next webinar next week how to actually get them solid in your mind so that when you're going and talking with a health professional, that you know and have really stepped it out. It leads to a better diagnosis, safer care, fewer delays, and a stronger trust because you are bringing that team around you. Yeah. You are employing your healthcare team. Yeah. You have the right to choose and decide who are those people. We want to build long-term relationships with the GP or the healthcare team. This helps to avoid repeating your story. I'm sure we've all repeated our story before, redoing tests or missing key information. And it's key to keep regular appointments. So follow-up plans and update that healthcare plan that we'll build in the next two webinars as well. Now, I want to just note that your healthcare team will change throughout your, I just really dislike the word journey. I feel like we're not going on a P&O cruise. It's very much more of a trek, the endo and pelvic pain trek, right? So this will change over time. That's completely okay. You are not doctor shopping. You are trying to work out who is the right person in your team. They need to align with you. Yeah. And you have a right to that. So it matters because, like I've said, you don't want to repeat your story every time. Conditions like endo, PCOS, persistent pelvic pain really benefit from continuity of care. We know that. And that GP can help track your symptoms, manage flares, and coordinate care across your specialists. They have the full picture of your health. And this is where longer appointments with GPs can be so useful because they don't have a lot of time to get through all of the information within that 15-minute appointment and then work on the next steps with you. So how you can show up in that appointment or in that team approach is so, so useful. And call us. Our wonderful nurse Jill is also here to help support you navigate all of this too. Okay, so look, what does this look like? Trying to book in with the same GP every time is really key. Keep a copy of your health summary or healthcare plan whenever you are discharged from anywhere. Get a copy of it. Keep that paper copy on you. Write down your symptoms, test results, and medication. Keep a journal and keep a log on it. And as you are going through that month or that 6 weeks or however long it is till your next check-in, note down all your questions to update for each appointment. I'm sure we've all been there where we have sat in a doctor's office and gone, oh, completely forgot what I wanted to say to you. I remember seeing a new gynecologist for the very first time only in the last few years. I've provided these webinars. I know all the theory, but I sat in that guy in his office going, I'm really nervous. I've completely forgotten everything I needed to say. So it's very normal. It's completely normal. Write it all down though, so that you're going in there and you are on track with what you want to get out of that appointment. Try and get as many follow-ups planned as possible. They book out so quickly. Leave with the plan. Leave knowing that I'm going to come back to you in 12 weeks' time or in 16 weeks' time and get it booked in before you leave. Something may come up in that time that you have that appointment booked in, ready to go. But if you don't, you can just cancel it as it comes closer to the time. But particularly around medications and all those types of things, having a point of contact and looping back in will help to build that continuity of care. Now, I want to talk to you about the Quendo app. So we have 24,000 users on this app now. We have got an amazing update launching later this month. So it's having a complete refresh, which is really exciting. But it is a good tool for you to track what's going on for you, journal what's happening for you. If you do have a flare, you can press this flare button here and it will say, I'm having a flare. You can jot down what's happening, and it also can help you access some of those healthcare plans that you may have gone through with your GP or will go through next week. This is a really good one. And we actually have just finished an evaluation that found people who are tracking their symptoms through the app. This app has a reduction in emergency visits, and also greater management skills for their conditions. So it's a really good one. I want to also talk to you about the mentor program. So our mentor program is a 6-week online program. So if you were struggling, or even if you just need someone to hold some space for you and talk through the different things, you can join as a mentor or a mentee. So if you scan that QR code there on the screen, you can now access, we're about to start another intake that we can work with you as a mentee through a 6-week program where we sign you up, link you in with a mentor, and we're working through with you about some of those questions you might have, or some goals, or some difficulty that you're facing, or if you're newly diagnosed, what are those next steps? Or if you are feeling as though you would like to be a mentor, we would welcome that too. So we work through a significant amount of training. We want to make sure that you are okay to support someone else, and also make sure that we are supporting you, supporting someone else. So there's also that option there to scan the QR code and fill out those forms. We will start an intake very, very soon. I've been mentioning Quendo Care. So this is free support for those affected by endo, adeno, PCOS, pelvic pain, infertility, all of the things that we cover here at Quendo. This is where you can scan that QR code or go to quendo.org.au/Quendo Care, and you can book in and speak with our nurse Jill, who is an incredible, incredible person, has worked in this space for so long, has worked in a bulk billing IVF clinic for a really long time as well. So if you have questions about that, we're really happy to answer them. People with endometriosis and similar conditions do have access to bulk billing IVF services. That was passed in legislation a little while ago. So we know it's a really costly exercise. Well, not really an exercise, that's another trick too, often. But yeah, people with endo or have a diagnosis or suspected endo can certainly get access to subsidised IVF, and also same-sex couples can access to. So yes, our wonderful nurse Jill is here to hold space for you, to debrief after appointments or a diagnosis. It's here for parents, it's here for partners, or friends, or someone if you are concerned and wanting to talk about those next steps. If you don't know where to start, we can also talk to you about some of those care pathways and how to navigate them, get you ready for appointments, support you through those as well. And like I said, supporting for partners and parents to be involved in care. Sometimes as a parent, we just don't know what to do with our kids, and then throw in endo or pelvic pain or adeno on top of that. It's really complex. So here to hold that space for you as you're understanding how to access the healthcare system, and can also refer back into our programs and our services. So a couple of next steps for you. We have Quendo Care, like I have just mentioned, our nurse-led phone support and debriefing service. We have our Manage Endo program. So there's a couple of different QR codes that you can scan on your phone, take a photo of it. But we will also share this as links to you all after the session. And this is where the Manage Endo program is the one where we have over 30 videos that talk in depth about the different ways to manage endo and the symptoms of endo and pelvic pain and adenomyosis, and more deep dive into the conversation around ultrasound and, what does a psychologist do to help, and how do they help? What tools and strategies could they provide to you? Looking at your gut and diet. Never suggesting an endo diet, but more trying to give you some tools about, okay, how do I actually manage this condition through understanding what triggers me or what causes me to bloat, etc. We talk about how to manage relationships, intimacy. There's so many different videos in Manage Endo, and it's a free online program. And if you don't know where to start with us, you can connect with our services there. Now, for any nurses on the call, thank you for joining us. Please email info@quendo.org.au with your reflections to qualify for your certificate. And you can also reference this code here, which I will leave up for just a moment, or any other health professionals for that matter. So that is the final, I will stop sharing my screen. That is the end of the presentation. I hope you have found that really helpful. I'm just going to give you a little moment to pop in any of your questions in the Q&A, and then Ash, I'll ask you to come online in just a moment and read them out, and we'll go through them. So I'll ask Ash to come online now, and if anyone would like to pop anything else into the Q&A.
Awesome. What a great session. I hope everyone has learnt a lot. The first question that we have is, no one has mentioned an OT before. How do you find an endo-competent one?
Okay. I think that, sorry, just give me one sec. Okay. There we go. Okay, so with the OT before, yeah, it's a good one. Again, I think it gets lost or gets forgotten a lot. So there would be, I would probably Google OT endometriosis or chronic pelvic pain or chronic pain and start to do that. I think that it would be a great way to do some searching yourself. They'll often talk about that who that they work with. So you'll have to do some searching. But I would also say that you could ask for a referral into the outpatient department or the public health service to see an OT to help manage some symptoms too. So that could be another GP question.
Awesome. We have another one saying, was wondering, where does timely treatment within reason come into rights and safety? We know that sometimes wait times are astronomical, and even getting an appointment can take up to a year or more.
Yeah. I know, it's so true. And so I think this is where you can engage with your GP and go back to them and saying things like, my symptoms are changing. Yeah. I would like to request a review of my categorization. Yeah. So when they're looking up those different categories, in terms of the treatment times, they're looking to see the severity, they're looking to see the implications and the quality of life impacts. So talk to the GP and have that GP write to them about what those quality of impacts are, if they're reducing. And also, this is where your tracking comes in. So talk about and track in, I'm finding this now, or the rate of pain or days of pain are increasing. It's impacting my ability to go to work, to go to school, to participate in social activities. So you want to advocate for what you're missing out on, where your quality of life is reducing. Now, having your GP rewrite to them can really help them to kind of reassess where you are. But you're absolutely right. The timely treatment does come into the healthcare rights charter. It does. Yeah. It comes into safety, receiving safe and quality care. It's really a good one. We know the reality is that it can take some time. So working with your GP can and talking about those specific things, about the impacts of your quality of life, what's worsening for you, what are the things that you're doing, yeah, and showing up into that partnership can also help to advocate for yourself in that system.
Awesome. We've got probably time for another one, possibly. Do you have any advice on how to feel like you're not doctor shopping and you don't want to feel like you're annoying your doctor by going there so often?
Okay. It's a good question. Really good question. Okay. So we're going to get in webinar 2 and 3 around how to actually work out your team. But what I would do right now is I would get you to start thinking about, what are your symptoms? So we have endo, we have adeno, PCOS, etc. But what are the symptoms that we are living with? What are the things that we are being impacted by? Where in our quality of life is being impacted? And then work out, and we'll go through this next week, who could that be? So in terms of doctor shopping, I'm just trying to find the one. Yeah, okay. So if we're trying to reframe our idea of doctor shopping, yeah, we're going, all right, well, what are my symptoms? What are my values? What am I trying to achieve here? And going in, and you're often interviewing a health professional. If you think about it like that, I'm interviewing you to see if you can help with my symptoms and you can align with my values. We'll go through that next week. But thinking about, okay, right, well, I've got this symptom and it sounds like you may not be across that. You may not be most up to date with that. And if you feel in your gut that something's not quite right, that's completely okay. Listen to it. Yeah. There will be other people out there. It is a mindset shift though. And if we come back into practically going, okay, these are my symptoms. These are the types of health professionals or doctors that I need. This is what I'm trying to achieve. That will help you better feel confident, hopefully, in that, okay, that doctor wasn't for me, or that health professional wasn't for me. Remember, we aren't going to like everyone. We don't like everyone. We're human, right? And so that's okay. It's the same thing for health professionals. They are coming with their own personality, with their own background, with their own education. That is okay too. Yeah. We want to find the team that works for you. Now, if you're feeling like you're going in annoying your doctor, why, right, we'll talk about this next week as well. But very quickly, we want to know why we're going in there. Okay. We want to have a strategy, we want to have a plan. And I'll talk you through next week how doctors are trained to think when they're seeing patients. And I want to teach you that. So you're going in there really organized. So you're kind of matching how they're thinking and how you're sharing information. And once you learn this, you'll be asked, are you a health professional? Because I want to teach patients, I want to teach us. I've had to learn it myself, how to talk to them effectively and how to get the answers and the information you need within a really short period. So we're going to go through that. But if you're seeing a doctor from now until then, think about what is your strategy? What are you trying to get out of that appointment? So every time you go and see them, you're not annoying, you're going in with a purpose.
Awesome. And Jess, there was one here in relation to when you're complaining to a healthcare regular. How does that go in terms of, you know, what should you do and what questions should you be prepared for?
It's a really good question. So again, I would encourage you to be curious. I know there's a lot of emotion that goes into this when when you've had a negative experience. I always encourage curiosity. We'll talk about this next week as well, but talking about trying to understand, or can you help me understand? This is my story. This is what happened to me. I would like to have a meeting with you to understand from my perspective. This is the care that I received, knowing there's always two sides to every story. We are showing up as humans, but going in with, this is what happened to me. I'd like to request a time to debrief with you, to talk with you. Here's all the things that I have done. Here's my history, acknowledging that a lot of time it is complex. Learning things about Ryan's rule in Queensland. I think it's called differently in other places. But Ryan's rule is where if you feel like you are not being listened to, or another member of your family is not being listened to, in the healthcare service, you can call Ryan's rule, which was introduced because of a little boy that didn't get the care that he needed. And so if you are feeling that's not happening, whilst it's all happening in the healthcare system, you can call a Ryan's rule and it will get escalated to the right safety and quality individuals within that health service. But if something happened and you are, needing to complain or raise a concern about a health professional in your service, that's what I would be doing with. I'd like to write to you to let you know I'm wishing to raise a concern about an experience that I had. These are my specific concerns. This is my story. This is what happened to me. If you have any suggestions or recommendations, I would encourage you to put that in there as well. You know, some improvements that you would like to see, and asking to sit down and yeah, meet with someone. I've had to do this. Um, I've been on the other end of people coming to me as someone who worked in that space to manage that. It's emotional. So having support people with you, having a support team with you, having space to debrief. I think the maternity services do it really well in lots of places. They have debriefing services. Call us. We are absolutely, you are here. We are here to debrief with you. We know some really difficult conversations and difficult experiences happen. That's what we have our wonderful nurse for. She can have a private conversation with you to debrief, to talk through what's happened and work out next steps. Um, but yeah, go and curious, try and understand what's happened. And if you don't know, ask, I'd like to understand what happened here, or this is my story. I'd like to better understand the systems and the supports and you know, have not this happen to someone else. Because I think that's often what we worry about is if this happened to me, I don't want this to happen to someone else. And yeah, that's how I would approach it. Okay. Thank you all so much for joining us. If you haven't already answered the poll, please do so. It should be up on your screen. Next week, we will be talking through some real practical tools. I want you to leave with tools and scripts and templates that we'll all send to you in how to advocate that, how to have those conversations, how to raise concerns, how to talk through things, and advocate for yourself in the healthcare system. Thank you so much for joining us this evening. And I'm really excited to talk through this with you next week. So we will see you then. Have a great evening. Bye.